Hello, everyone. My name is Rick Kaufman with the Kels Group, aka the Drowning Warriors. And today I'm going to touch on topics like mindset, culture, passion, personal impact, all of which you, your business, and your teams work through every day with your clients and members. And the goal of this presentation is to provide a personal message that educates everyone here today that you can personally and professionally prevent drownings. And you can build a new foundation around water safety. But how? Well, first of all, question. Why does drowning happen? Well, the answer, people just don't believe that it can happen to them. Drowning is silent and it shows up when you least expect it. I have found that we do not have any effective water safety plan of action here in the United States. But what does the CDC say about drowning? And every day, about 10 people drown from unintentional drownings. Of that, 2 are children ages 14 years or younger, and drowning ranks 5th among the leading cause of unintentional injury death here in the United States. The problem is huge. From 2005 to 2014, there was an average of 3,536 fatal unintentional drownings, and these are non-boating related. And if you add 332 people on top of that, those are the boating related incidences. The problem is huge. What does the USA Swimming say about the numbers? And when you think of USA Swimming, I think you think of the sport of swimming, competitive swimming, athletes, all these type of things. But here's a slide of the United States. Where is your state? And take a look at the number on the state. The USA Swimming does other things besides the sport. They also track numbers and data. Okay. What is the number on your state? These are the drowning deaths by state from July 2008 through July 2018. And if you're in Florida, Texas, or California, you're leading the way with more drowning deaths than any other state. I'm here in Ohio, 611. But let me just say, each and every one of these represents a real person, and each and every one of these is preventable. Those are the facts, and these are real people. So you may be wondering why I, Rick Kaufman, I'm here telling you about these facts. Well, let me tell you something. It all started because I was one of those real people, because it happened to me and to my family. This is my 3-year-old daughter, Kelsey, and she fatally drowned. It was June 15th, 1993. She was attending our local public pool with her babysitter for her older sister's swim lessons. 45 minutes later, she was found in the pool by 2 other boys, 8 feet in front of a lifeguard. That was just the beginning of a very long journey in my life. And why didn't I know of these dangers? Why didn't I even do something else that day? These questions and many, many more have been with me all these years. But drowning doesn't just affect the person who drowns. It affects the parents, siblings, community, staff, organizations. In fact, it affects everyone. And 8 years later, I'm going to ask you to close your eyes and think about 8 years ago. Think about something that happened to you. It's not as easy as you may think. That would be 2011. Was it a happy moment, sad moment, something that stands out in your life? Can you remember something? Well, for me, 8 years after my daughter drowned, my life came crashing down. This is another story really for another time. But you may ask why. Well, it's because I wasn't going to accept more death in my life. You see, I made a promise to my daughter to make a difference and help others in this mission and cause. And I was going to keep that promise, but how? Let's join the revolution and save 185,000 lives from drowning and over 1 million lives from non-fatal drowning. And now let me tell you a little bit about the problem and why it's so important. The key here is to create a movement. We have the plan on how to save 185,000 lives worldwide and over 1 million lives from non-fatal drowning, but how? I'm asking the health club industry to lead the way in a new beginning in water safety and drowning prevention. You know, I have a leading podcast where I've interviewed leaders in all areas of the aquatics industry, and we are a new breed of people, and I call these people drowning warriors. I do this to give a voice to those who no longer have a voice, and for those who do have a voice, a platform to project their voice. And after talking with these people, and well over 1,000 people in the last 12 months in all areas of aquatics, they've all told me that we need a leader for all others to follow. I really refer to this as kind of like the one big domino. You know how dominoes work? You knock one over, then starts that long chain of reaction where they all get knocked over? Well, it's real simple. You knock it over and we can win. That is a group to lead the way. That's you, everyone in this room. And here's why. There's been an average of 1,000 children that have drowned every year since 1993 when my daughter had drowned. And if you add 3,000 adults to that number, that's a total of 4,000 drownings here in the United States. These are the numbers that we know of. Not the numbers are probably double these based on how we track the data. And this really is not to mention chemical burns and chemical testing, mechanical problems, overall operations, staff training and certifications, and we have to also mention water clarity. That has all been taken into consideration, or this all has to be taken into consideration when we're talking about water safety. In addition, data shows 37 to 41% of adults here in the United States do not know how to swim, and nearly doubles based on social, economic, financial environments, which means they couldn't even save their own children if they wanted to. And nearly 20% of drownings occur in a pool with a lifeguard, such as my daughter. It is generational, it is cultural, it is seasonal, it's casual awareness, it's perceptual. It is in fact no different and just as easy as getting a couch potato to work out. We know we need to be effective with our message, but pool people can't do it on their own. Drowning doesn't discriminate. It doesn't care if you can swim or not, or even what kind of athlete you are. And to be clear, I'm not a pool guy, I'm not a lifeguard or a pool manager. I wasn't a competitive swimmer. I am not a swim instructor or a CPO. I don't work for the YMCA or the Red Cross or Star Guard. I don't train guards or safety staff. But I have the same goals. And I believe gathering information from supporting aquatic experts and then sharing my findings will affect change. Change the message, change the delivery of that message, and change the way we educate. And think and act differently. For example, when we think of fire and safety standards with fire, we have plans, drills, and alarms, and etc. Just like stop, drop, and roll. When our kids see a fireman in their full gear, we can feel safe in an emergency. So we must start to understand that people will enter literally any body of water thinking they can swim or feeling safe. But we can change that by changing how and what information we deliver and how we think about water. For example, if you can't swim, don't go in. In summary, it's about changing people's behavior. If you can change their questions, you can change their thinking. If you can do that, you can change their life. And if we can do those three things, guess what? We can save their life and or their loved one's life. But what about drowning and water safety? Yes, we have swim lessons and lifeguards, and yes, we have water aerobics and all those other things. And yes, we have life jackets because we know if you can't swim, but we still put you in that pool. But are we, the industry leaders, speaking with our teams and really understanding the risks and the risk factors that go into someone drowning? Do we have a meaningful message, training, and education that showcases a change in how we talk about drowning prevention? So back to my story here for a minute. When I saw that there has been zero reduction in drowning, especially for children, that's when I knew I had to do something, so I did. I took a look at MAD, Mothers Against Drunk Driving. They went after the bartenders and bar owners to solve the problem around drinking and driving. They had a message, don't drink and drive. They had a program called the Designated Driver Program. They created a movement and changed the behavior of a whole entire industry. And in the process, I don't think you can argue that they saved thousands, if not hundreds of thousands of lives. And I'm currently working with hundreds of aquatics professionals every month. And the future is in the fitness and wellness industry. And by the way, that's all of you. Listen to me now. While you're thinking of your children and how much harder you're just going to hug them tonight. And so let me share a little bit of data from the National Institute of Highway Safety, traffic deaths of children ages 13 and under to help tie this together for you. I've got two charts here. The one on the left signifies kind of like the roller coaster when you look at a graph, right? But what I want to point out with this right here is right around 2004, you see a very large or a spike downward, a downward trend. This kind of correlates with social media. Mothers Against Drunk Driving, Click It and Ticket, a lot of messaging around, the education and being safe and being a safe driver, about car seats and educating parents the importance of putting children in car seats. Now we go over to 1993, the year that my daughter drowned. Remember, there was 1,000 children that drowned that year, and actually take note, every year 1,000 children have drowned for the same period of time with zero reduction, and has averaged that every year since. And we fast forward from 1993, where there was 1,221 fatal accidents in cars involving children 13 years or under. And we fast forward to 2017. They reduced that number to 677. Here's an important note to understand. Population increased by 60 million people during this period of time. So how did they do this? Okay, obviously safer cars, all these things, but how did they do it? That's a 50% reduction in fatal deaths of children under the age of 13. And let me ask you a question. Would you put your child in the backseat of a car without a car seat today? No, I don't think you would. So what are we going to do reduce the deaths and injuries in pools, and why it hasn't been done yet? Here's what I'm doing about it. Just for example, I'm living my passion, to make an impact and begin to decrease the number of drownings, not just here in the United States, but around the world by 50%. That would be a reduction of 185,000 lives from drowning and over 1 million lives saved from non-fatal drownings. Now I can keep my promise to my daughter I made that day following her drowning back on June 15th, 1993. And this is the Drowning Warrior Project, where I share my story and encourage in a new way to think, is how I came to be here with you today. And I want to introduce you to the Kelsey Code. I spend over 30 hours a week with aquatic leaders and staff talking about how we can improve and enhance their message around aquatics. It was through this work that I met Wesley King of Wesley King and Consulting, RippleEffect.co, and Timothy Pesh of TMI Sustainable Aquatics, who both are leaders in this industry and are helping to change the way we think about water. And I'm going to spend the next 5 minutes or so and share a very special message with you that I created just for you. This is about laying a new foundation for success. And actually, this is our success together. And that is the Kelsey Code that I mentioned earlier. The first step in laying your new foundation is I'm going to ask you to text the word Kelsey, that's K-E-L-S-E-Y, and text my daughter's name, Kelsey, to 937-314-6201. This will get the process started. And in turn, you'll be directed to step 2. That is to complete your club pool customized risk assessment that we're going to email to you. If you don't want to text, you can also get started by going to www.thekelsgroup.com/Kelsey Code, and that's Kelsey, K-E-L-S-E-Y-K-O-D-E, to get started. And by joining the mission and implementing our Kelsey Code, you are preparing yourself, your team, your staff, and most importantly, your customers to see you as the leader in this movement. It's real simple. You're the leaders of this industry. You're executives, GMs, directors, teachers, educators, and basically you guys get results. This is your chance to stand out and show your members the kind of leader you are. Just so you know that implementing your Kelsey Code here today, that we are not asking for your money. It's really so much more than that. It's your commitment I'm asking for. So now, when you're thinking of your children and how much harder you're going to hug them tonight, it's because you're laying that foundation. You're laying the Kelsey Code foundation. When you think of foundation, you're thinking about something that is built on top of that. It is extremely strong. And you're going to do this by texting Kelsey. Again, the phone number is text to 937-314-6201. And at the end of the day, I want to see more people enjoy water, to learn to swim and to be safe, to live a more active life, to allow them to live a healthier life by swimming and understanding all the benefits that brings. And I know you want it too. And in summary, this is about mindset. It's about changing a culture. It's about, personal passion. It's about leading the charge. This is about making a choice to change how an industry is led. So I'd like you to leave you with this. If you'd like to learn more about the Kels Group, aka the Drowning Warriors and the Kels Code, you can always go to thekelsgroup.com/podcast and listen to our podcast. But also you can email me at rick@thekelsgroup.com. Contact me via my cell phone number or my office number that is listed there on this page. We've got some special handouts. If you'd like that, a card or special information here, please see me at the end of the presentation. Thank you for listening.